Hey, it's Dr. Brower.
And I'm Dr. Emily.
And this week we are talking straight about sinus infections. Ooh, yay to the Midwest. It sucks sometimes. Farming season, so terrible. I struggle with allergies, so I'm right there with you guys. But there's lots you can do. There was like 2 summers ago, I went like viral in the mommy group for not pooping. But it was like, go get sinus release work done with Dr. Brower. We can do that. That's the most basic thing we can do here, however. So start there, but then Dr. Emily has a whole plethora of issues and things she wants to talk about when it's related to sinus infections. So I'm going to hand it off.
So what we can do when we adjust you for your sinus infections, we can release all of your cranial bones. So we can do like your ethmoid in here and your nasal, your frontal and your sphenoid to kind of open up all of that in there to get everything draining, which is really great. Your C1 and your C2 at the bottom of your skull can tend to help with the drainage in there. And we tend to get a lot of neck issues when you guys have sinus infections because you have all the drainage into your stomach. And so all that snot is irritating your esophagus and your stomach lining. So that gives a lot of tension. It's true though, into your neck. We also have, you do not have to run and go get an antibiotic. I have a plethora of different herbs that you guys can take instead of going to get another round of antibiotics to help with sinus infections. We also have the laser that can help bring down the inflammation in your nose. If you have that like swollen nose that you can't even blow everything out because it's so irritated, the laser can help with that. And we also have the Rocasa nasal spray that has colloidal silver and a couple essential oils in it that can help kill everything else too up in there. So yeah, don't just go run into your, urgent care PCP for a sinus infection. Come and see what we can do for you and help you out.
Yeah. You have lots of options. Remember, we like to save antibiotics for last case scenarios because then they're even more effective. When we need an antibiotic, we want it to be effective. If we overuse them, they're not as effective. That's why we do what we do, guys. We're not telling you that the antibiotics don't have a time and a place. They do. But when we overuse them, they're not as effective, and then they don't work when they need to. So it's really
especially
not
when you get the same sinus infection every year. You need to do something different.
So exactly. I hope you guys have a great week. Any questions, as always, drop them below.